It's day 2 of yet another doctors' strike in Nigeria, the fourth of its kind in just over a year. And it comes as the country sees a rise in COVID infections. The doctors say the industrial action is over pay and working conditions, and that this is their last option after the government failed to respond to their grievances. The BBC's Ewokor is in Abuja.
Patients in Nigerian public hospitals are now left again to their fate. Doctors have walked out of their jobs, the fourth time in just over a year. Resident doctors are pivotal to frontline healthcare in Nigeria. They dominate the emergency wards in its hospitals. The doctors say government has failed to address the issues of delayed salaries and allowances.
Some of our members are being owed salaries of up to 10 months. Some up to 8 months at the state tertiary institution. And you believe that as we speak, what I get and other health workers is 5,000 as hazard allowance, considering the enormous hazard we are exposed to. This, we believe that even federal government is playing politics with it, with the issue of the improved hazard allowance, which is not proper.
The government has called a meeting with the doctors today. It's asking them to consider the damage their withdrawal of services would cause the country in this pandemic. Nigeria's healthcare system remains fragile. Experts say hospitals here barely manage to cope with poor funding and inadequate equipment.
Nigeria faces spike in new COVID-19 infections. Isolation centers that were closed after the previous surge have now been reopened in anticipation of large number of patients. But with the doctors now on strike, it seems the patients will now be left to handle or tackle their health challenges on their own.
The doctors' strike is happening at a time President Muhammadu Buhari is in the UK for a medical checkup, drawing criticisms to the government's handling of the country's healthcare sector. Ewokor, BBC News, Abuja, Nigeria.